80% of patients aged 75 years of age take a medicine, some form of prescribed medicine. And 36% of these patients take more than 4 drugs. And this would be encompassed as what we call polypharmacy. And 50% of these medicines are not taken as prescribed. So I'll come on to talk about medication reconciliation and medication reviews in a little while. So adverse reactions accounts for 6.5% of hospital admissions, with over 70% of those avoidable. So this is really important. This 6.5% of hospital admissions is mainly in over 65s. As Sunfrail encompasses frailty, Sue has chatted about it last month about what we actually term as frailty. So what people in the community see as frail, they don't always see themselves as being frail, which is a very, very big thing in our population of geriatric patients. So it's termed by the British Geriatric Society as a distinctive health state related to ageing process, with approximately 10% over the age of 65 being classed as frail, and then that rising to between a quarter and a half of the population over the age of 85 being classed as frail. So frail, a person who is frail qualifies to be frail if they have 2 or more of these syndromes. So this encompasses falls, immobility, delirium, confusion and muddledness, continence issues and susceptibility to side effects of drugs. So some of the drugs that we use, in fact quite a lot of the drugs that we use, are a cause of falls and frailty. Frailty is not static, it naturally varies with time. Medication accounts for 10 to 20% of all falls, and polypharmacy accounts for a 20% increase in a falls risk. So this increased risk of falling is seen when you have an increased number of medicines, what we term as polypharmacy, greater than 4 or 5 medicines, or an increase in class of a certain drug, and that is something that is certainly reversible. Medicines optimization really is an approach that seeks to maximise beneficial health outcomes and minimise the risk of harm from medicines use. So this is what we should be incorporating into our daily practice. So medicines optimization has 4 key stages. The first one is that you aim to understand the patient's experience, and that's something that is in all of our acute care at home treatment. The patient's experience is number 1. So how they perceive us, how they perceive their treatment, how they're going to respond to their treatment. And then thirdly, ensuring that the medication use is as safe as possible. So are we using the correct doses? Are we using the correct strengths? Are we using the minimum doses that control a symptom?